Hello, everyone. We have the pleasure to present our research project in the International Congress for Qualitative Research and Theory Methodologies. We would like to welcome you to our research project titled Time to Table, a qualitative study exploring the barriers and enablers to surgical intervention in a regional Australian hospital. Australian regional health centres cover the healthcare needs of vast geographical areas, often acting as critical hubs for emergency surgical care. These centres frequently function as the primary and sometimes only hubs for emergency surgical interventions, meaning that any delays in operative management can have profound consequences. Timely access to surgery is a cornerstone of effective clinical care, and when it is compromised, the repercussions are multifaceted. Delays in surgery can have a wide array of complications, including increased rates of infection and mortality, and prolonged hospital stays. In some cases, delays result in the need for revision surgeries, or more complex procedures that could have otherwise been avoided with prompt intervention. Beyond the direct implications, surgical delays also erode patient and family confidence in the health system, reduce overall satisfaction with care, and amplify the psychological burden on patients already experiencing acute illness or injury. From a systems perspective, inefficiencies in timely surgical care translate into extended bed occupancy, higher utilization of intensive care resources, and greater financial strain on hospitals that already operate within limited budgets. Recent audits conducted in one regional Australian hospital revealed significant delays across various surgical procedures and patient demographics. These audits provided valuable quantitative insights, such as identifying patterns of delay in particular specialties or age groups, and quantifying wait times relative to benchmarks. However, while such data are invaluable in capturing the scope and scale of the problem, they also revealed the limitations of purely numerical analysis. Numbers alone cannot fully explain the contextual and systematic factors that underpin these delays, such as workforce shortages, limited access to specialist services, constrained operating theater capacity, transfer and transport logistics, or the challenges of balancing emergency and elective surgical caseloads in resource-limited settings. Consequently, they highlighted the need for a deeper understanding of the contextual factors contributing to surgical delays. Understanding these underlying causes is essential to developing meaningful, sustainable solutions that can improve surgical timeliness, optimize patient outcomes, and reduce the broader economic and social costs of delayed surgical care in regional Australia. The primary aim of this project is to improve patient care and experiences by improving clinical outcomes following surgery. Our objectives were to gain an in-depth understanding of staff experiences and perspectives of the barriers and enablers to surgical intervention, and to develop actionable recommendations to inform clinical governance and hospital policy. As there have been some noticeable delays with bringing patients from the emergency department to theater, this project focuses on identifying these barriers in a qualitative manner by exploring the perspectives from different team members, ranging from ED medical doctors right through the surgeons and everyone in between. Employing a qualitative design, we first conducted surveys with the staff involved in the emergency surgical pathway to theater. These findings then shaped a series of semi-structured interviews conducted until data saturation was reached. Thematic analysis of the interview data revealed key contributors to surgical delay within the regional hospital context. We are hoping to isolate particular areas in which these delays occur through structured interviews from allied health staff, nurses, and doctors. what we are hoping to find are points of focus which can be improved through intervention, which will ultimately improve our times to table and therefore positively impact our infection, complication, and patient satisfaction rates. This slide shows the journey of a patient from the moment they arrive in the emergency department right through to when they reach the operating theater. It depicts the complex human and logistical processes that may ultimately delay a patient from reaching theater. Patients can arrive either by ambulance or as walk-ins. The very first priority is identifying whether they are critically unwell and need immediate attention. At triage, a nurse checks the patient's vital signs, asks about the presenting complaint, and allocates a triage category to determine urgency. Sick or unstable patients bypass waiting and are taken straight to a resuscitation bay. Once in the ED, the doctor performs an initial assessment. At this point, intravenous access is secured, bloods are taken, and analgesia is given. If the patient is unstable, immediate stabilization is crucial. Next, investigations are ordered, including blood tests and imaging. If surgery is suspected or confirmed, the ED team refers to their appropriate surgical specialty. The surgical team then reviews the patient themselves. Based on these, they decide on the most appropriate management. Pre-surgery optimization is all about getting the patient ready for theater. The anesthetist reviews the patient to assess risk. Consent is taken from the patient, or, if necessary, their next of kin. Once the patient is optimized, the case is booked. The theater team is informed. That means the anesthetist, scrub nurses, among others. Equipment, prostheses, and blood products are prepared. Finally, the patient is transferred to theater. The patient then arrives in the anesthetic room, where induction for surgery begins. With our research, we hoped to gain an in-depth understanding of the staff perspectives on the barriers and enablers to timely surgical intervention. The results from the research project were used to develop recommendations to guide local change in hospital practice, processes, and procedures. We hope that our project can shed light on the areas for improvement and suggest actionable interventions that can be followed to reduce the time to theater. Our ultimate outcome is to improve patient care and satisfaction by reducing the risk of surgical complications associated with surgical delay. We hope our research project can be a foundation for future research in other healthcare centers across Australia, particularly in the regional and remote centers. Thank you very much.